or directly, and I will respond to the questions individually. That's a tremendous benefit, I feel, with some of these webinars. CAPA is a big deal with the FDA. We'll talk about that as we go through this. I'm going to be covering points that you may view as, well, this is not rocket science, or I knew that. But some of the points that I bring out will be designed to help you to sell the program to senior management. For those of you that might be in middle management or in a staff position, sometimes it's hard to get the resources dedicated to fully resolve a CAPA issue, especially in failure investigation and root cause analysis. So look at some of the points that I'm bringing out as a way in which I can try to sell this to senior management to get the resources and time commitments necessary to do the job, an adequate job, and satisfy not only regulatory agencies, but satisfy the issue that CAPA has raised, corrective and preventive action. We're going to be examining the points that are listed here on the agenda. And again, if you feel I've slighted over a point, not covered a certain bullet point you need additional information on, or don't address a point that you felt you signed up for expecting it to be addressed, jot that down and we'll address it during the Q&A session at the conclusion. Now the title talks about robust. Sometimes we appreciate the fact that closed loop is another term, and you'll be noticing that throughout our discussion here. I've used those terms in the past. Other consultants have used them in webinars. What does it mean? Well, first of all, the expectations from your regulatory agencies is that your CAPA system captures everything. Now, you may choose to address certain things like delivery dates and that under a separate system. That's up to you. Smaller companies generally throw everything into the mix. You don't want to be filtering out stuff until it's consciously filtered out and documented as to why. So some of the things that can filter out is the fact that you might have gatekeepers in your company. When I do independent audits of companies, I find this a frequent problem. You have to analyze how does information come into my company that indicates a problem externally, complaints, warranty claims, etc. Sometimes those are directed direct to the help desk, customer service, marketing, tech support, and some of these areas are not too keen on filling out complaint forms or other forms that would link it to CAPA. So it's up to you as a company to evaluate, do I have individuals that just receive an information that really might be a complaint or receive something they don't make an analysis as to whether it is a complaint or not and just forward on trying to do a good job and satisfy the customer, which is appropriate. But as a result of that, some key pieces of data or data streams are not captured at all by the company. The expectation under a fully functioning CAPA system is that a non-conformance complaint out of specification condition is reviewed, it's investigated, and we'll talk about a template there, possible template, and it's tracked down to the root cause or causes. If not the first time through, your system is such that it will trigger a reappraisal, reevaluation, and further analysis to get to root cause. That all of this activity be documented so that you can prove you did it, and that it's used to improve the product and or the process over time. For those who use in pharmaceuticals, you're aware of the process validation guidance document that came out a couple of years ago. The FDA in that document talks a lot about life cycle and the expectation that your knowledge of your product and your process grows over time, that your ability to identify variances and reduce variances to increase homogeneity within a lot or between lots increases over time. And one of the key factors in helping you to do just that is a fully functioning CAPA system. So again, this is a crucial element of compliance to the GMPs. Again, what does the FDA expect? Now, a lot of my focus in this discussion will be FDA expectations and, by extension, notified body expectations for CE marking and for quality systems that are not related to the U.S. GMPs, such as 1345 or 9001. But the key point to keep in mind here is even though we're talking about regulatory agencies and their expectations, you should be looking at CAPA beyond that, not to get a warning letter, not to get a 483, but how can CAPA help me to have a better product, a safer product, a less liability-prone product out in the marketplace? How can I meet on a regular basis my delivery commitments, et cetera? So to me, CAPA makes good business sense, and that should be the driving factor. If you're trying to sell this to senior management, yes, compliance to regulatory agencies is important and critical and can cost you billions of dollars if it isn't, based on fines, et cetera. But on the other hand, a good CAPA system, ultimately, if you define it from a standpoint of what senior management looks at, finances, you can make a business case for a good CAPA system. So, and that's what I'd like to stress, even though most of you probably signed up with the expectation, how can I avoid problems with regulatory agencies, which is a legitimate reason, but to me it's a negative reason as opposed to some of the positive reasons I just mentioned. Now, it is expected that your data is captured and recorded, documented, if you will, whether it be electronically or manually, that you conduct a failure investigation and drive it down to the root cause. And when we're talking about activities here, we're talking about risk-based, and when I talk about risk-based in the context of a regulatory environment, I'm talking about product use risk-based. Risk-based down to the patient, the end user, the clinician, the doctor, the nurse, the practitioner, the technician, etc. The impact analysis, we'll talk about that, a neglected element of CAPA. That it drives improvement, again, getting back to that expectation, the FDA, and any of your basic quality gurus from the last century, for example, Schuhart, Deming, Duran, Gurna, and others. The expectation was that this would be part of continuous improvement of your product, your quality management system. That your activities